medical school, doctors are trained to look at patients objectively and to treat their problems scientifically. But of course, it's also important to develop that doctor-patient relationship by having empathy for what your patients are going through. This can be particularly strong if the doctor himself has also gone through what his patients are experiencing. For instance, if an orthopedic surgeon has had a hip replacement, he's going to have just a more natural, inherent understanding of what his patients are going through than if he hadn't. Similarly, if a psychiatrist has struggled with a depressive episode, substance abuse, trauma, or anxiety, then he's going to have a more natural understanding of treating his patients with the similar issues. It's for this reason that just generally I prefer to treat male patients because I have a more natural understanding of what it's like to be a guy than I do of what it's like to be a woman. Also, I can relate a bit more to my patients who are experiencing depression because I did also have a depressed episode. But one thing I could just not relate to at all with my patients is when they have intrusive and sincere thoughts of wanting to kill themselves. Our basic human instinct is survival at all costs. So how can that instinct be overridden by intrusive thoughts of self-destruction? Of course, there's a spectrum of pathology, like there is in all mental health diagnoses, with suicidal patients. On the one hand, you have people who are seemingly happy and don't necessarily even have a history of mental health conditions, yet for some reason are dead set on killing themselves and will do so while completely sober. And on the other hand, you have people with serious substance abuse problems who try and kill themselves or do while intoxicated, but would otherwise not have done so if they were sober. But the end result is the same. A person's either dead or seriously disfigured because they tried to kill themselves. Now, this is an important point to emphasize because many people don't realize that a lot of people try and kill themselves and don't actually succeed. And it's more often men in this category because while women make more attempts at trying to hurt themselves, it's men who make more lethal attempts and leave themselves horribly disfigured and injured if they don't succeed in dying. So some examples I've seen are, for instance, a military veteran a few years ago who wanted to kill himself and he got a crossbow, pointed it at his eye, and fired it. He didn't die, but he came into the hospital with the shaft of the arrow sticking out of his eye socket and the tip of the arrow lodged in the back of his skull. Now, neurosurgery was able to remove the arrow, but of course he lost his eye and he had some permanent paralysis on one side of his body, and he lost control of his bladder, leaving himself permanently incontinent for the rest of his life. I've also had patients who have stabbed themselves in the heart, resulting in massive open heart surgical wounds on their chests and permanent cardiovascular problems. Of course, I've also had many people shoot themselves in the head, leaving themselves horribly disfigured and with permanent neurological problems based on the type of brain damage they did. There's also many people who try and slash their wrists to bleed out, but many don't, go in for surgery and get sewed up, and are left with very large, very visible scars that indicate to everyone what it is that you tried to do to yourself. Now, for those people who try and kill themselves while they're intoxicated, the best thing to do to prevent them from making a suicide attempt is to keep them sober. But what about those people who are intent on killing themselves while sober and don't have a substance abuse problem? Well, a big risk factor is, of course, having an underlying mental health diagnosis. People who have a history of major depression are more likely to try and hurt themselves when they're depressed. People with bipolar disorder are more likely to try and hurt themselves if they're in a manic phase and doing impulsive, erratic things and perhaps delusional. And people with psychotic disorders like schizophrenia can have auditory hallucinations commanding them to kill themselves for whatever reason, or can be paranoid and also delusional, thinking that they're supposed to kill themselves for some reason. Often, though, there's also some kind of stressor that pushes someone over the edge to try and kill themselves. And with men, I find it often has to do with rejection from a romantic partner or financial stressors like loss of a job. Both of these things seem to just completely dysregulate some guys to the point where they try and kill themselves even if they don't have a history of mental health problems. Another important thing to look out for are rehearsal behaviors. People don't generally go from 0 to 100 with their suicide attempt and just grab a shotgun and shoot themselves in the head. Usually there are far less lethal things that they try and do to themselves which escalate in intensity to the point where they actually do something lethal. So if you see someone suddenly doing things to hurt themselves, or talking about hurting themselves, or posting about hurting themselves on social media, it's important to take that real seriously and get them help immediately. So treating suicidal patients often involves, first of all, treating the underlying mental health problem that they're experiencing, and trying to help alleviate the stressors in their life that are pushing them over the edge. Both of these things, of course, do take time, though, because medications can take a little while to work, and whatever stressors they're experiencing in life aren't going to just go away immediately. But every state in the country does have its own type of involuntary commitment laws for patients who are a threat to themselves or to other people. Unfortunately, these laws do get abused, and I frequently see patients in the emergency room who come in saying they're suicidal just to, get committed to the hospital to get off the streets for a night. But when used appropriately, these laws can get people who are truly suicidal the containment and supervision and treatment they need right away. Lastly, if you are thinking about committing suicide, I'd implore you to think about what that does to your family. It's completely devastating to family and friends who are then left with many unanswered questions, the guilt of feeling like they should have done something, and the trauma of finding you if you did something horrific to try and kill yourself and now you're dead and disfigured. So whatever it is that's going on in your life that might have you thinking about making a suicide attempt, don't catastrophize it, and instead get the help you need.